So you'll have an opportunity to get the copy of the presentation. So go ahead and I'll turn it over to Dr. Egan. Dr. Egan, whoopsie. There we go. Doctor, can you hear us? I'm sure he's there. Let's give it a second.
Good morning.
Good morning.
Sorry, I'm not sure what happened with my microphone, but it seems to be working now. Happy to be here with you all. So we're going to run through the presentation now, talk about a little background information, what you can do with that information to help your employees safely return to work when it's appropriate, some masking guidelines, and a few updates related to changes that have happened recently with science and guidelines from the government. Next slide, yep. You've all probably seen some version of this curve here. If we look at curves from our region, we see that there was a peak. We see that there's some promising trends recently, but certainly not a huge drop off. We are still seeing lots and lots of cases every day. The curve has not completely flattened, but it's starting to trend in the right direction. We're still seeing a number of cases in the filling up the hospitals, but it's starting to get under those thresholds that we'll talk about a little later that will allow us to open up slowly but surely. As for research, we do expect some resurgence once society starts to open up again, but this can be blunted by social distancing and wearing masks, the hand washing that you keep hearing about, using disinfectant and disinfecting surfaces. And then testing and tracing are going to be a key part, and federal governments, state governments, local governments, and healthcare providers are going to play a role in that. Back on April 16th, the White House released some national guidelines on how to reopen. According
Doctor, I think we lost you for a second there. Dr. Egan? Well, maybe a little technical.
Can you all hear me now?
Yeah, absolutely.
I'm sorry about that. The microphone keeps cutting out. Let me just start this slide over to make sure that I didn't miss anything. So this is just showing the guidelines that the White House presented. The White House released these guidelines on April 16th about how to reopen. According to the guidelines, we can bring the process of reopening once certain gating criteria are met. Those gating criteria, you'll see some version of with each city and state having their own version of it, but they're all kind of based off of those national guidelines. I'm sharing what we currently know about the federal and state and local guidelines for how to return to work safely and what we can see our healthcare's role in keeping those employees healthy and safe. Next slide. All right, this is the proposed framework for gating criteria that would need to be satisfied before starting a phased opening, and then must be resatisfied before moving from one phase to the next. First, there has to be a downward trend in flu-like symptoms. Those are the symptoms like fever, chills, muscle aches, and possible COVID-19 cases over a 14-day period. Then there has to be a downward trend in documented COVID-19 cases and the percent positives of the cases. The percent positives are out of all the tests that we have, how many of those are coming back positive. Our region was having a really high percent positive, around 25, 30% for a long time. The goal is to get those underneath 10%, and we're seeing our region gradually go towards that goal. Hospitals also need to have the capacity to care for patients without going into surge mode while ensuring that healthcare providers are staying safe. So we need to have enough hospital beds so that if the patients with COVID start to increase, we have room to take care of them. Surge mode would be kind of when we're using those hospital beds that you've heard of hospitals creating that would not normally be there, or hospital surge sites like the one that's been made at the convention center here in DC. So what are employer responsibilities? This is a tricky question that's going to vary a bit from employer to employer, but employers have a number of responsibilities for that work environment is safe for employees and to prevent the spread of the virus to the public. Employees are also responsible for ensuring adequate physical distancing while at work. Employees should physically distance when they take breaks together. Breaks should be staggered so that employees don't congregate in break rooms. Masks should be worn at work whenever possible, and employees and employers should pilot test these masks to make sure that they don't interfere with the work assignments. Sick people should not come to work. This is probably the most important point. It is the employer's responsibility to make sure that if they do, they are sent home immediately. Employees should check their temperature at home before even getting in the car for work. And then once they arrive, employers should measure the employee's temperature and ask about symptoms before allowing them to start to work. Ideally, temperature checks should happen before the employees enter the workplace. If possible, employers should work with facility staff to improve air exchanges in rooms, and they should increase the frequency of cleaning commonly touched surfaces, most importantly, things like door handles, faucets. Right now, there is no requirement for employers to be able to test employees for COVID-19 on site. Healthcare organizations and public health departments are having difficulty obtaining the equipment and building the capacity for sufficient testing. It's unreasonable to require employers to have the ability to test right now. This may change as testing becomes more available and testing methodology changes. It is, however, the employer's responsibility to develop and implement policies and procedures for workforce contact tracing when an employee tests positive. The national guidelines do say employers should not allow symptomatic people to return to work until cleared by a medical provider. And we're going to talk about what that means on the next slide. All right. These are the approaches employers should take when they think about the national guidelines that say employers should not allow symptomatic people to return to work until they are cleared by a medical provider. Employees should remain in home isolation if they are symptomatic. They can return to work at least 14 days after the onset of symptoms, and they have been absent of fever for at least 72 hours without the use of anything like Tylenol or Advil. If an employee has a high-risk exposure, we usually define the high-risk exposure as being within 10 feet of someone for more than 10 minutes at a time, they should remain in home quarantine for 14 days since the last high-risk exposure. This is true even if they are asymptomatic. Some employees can self-monitor while at work. This includes asymptomatic people with low-risk exposures, so just passing someone or being in the general room as someone, but not within 6 to 10 feet, or critical infrastructure workers. These employees may continue to work and they should check their temperature daily. They should report any symptoms to a supervisor. Next slide. All right. So this slide walks us through what happens if an employee has symptoms. So if an employee reports that they're having a fever or any other flu-like symptoms, they should be sent home immediately. The employee should reach out to their healthcare provider, preferably remotely through a phone call or video visit, or calling the advice line if they have one to access. Then the employee should talk through those symptoms that they're having, any exposures that they had with their healthcare provider. The healthcare provider will help them figure out if this doesn't sound at all like COVID, there's no suspicion there, then the employee can return to work. This is happening often for us with patients who are having allergy type symptoms, which is very common this time of year. It can be difficult to sort those out. Is my scratchy throat from a virus, from coronavirus, or is it from allergies that I experience every year? And their medical provider can help them sort that out. If they are presenting with symptoms that look like coronavirus, then they probably need to get testing, and the healthcare provider can help them arrange that. They have a negative test, then they can return to work once their symptoms are gone away. So they're not having a cough anymore, they're not having fevers anymore. If it comes back positive, then they need to remain out of work for 14 days after their symptoms started and until they have not had a fever for 72 hours. Both of those criteria need to be met. We do not use COVID testing to say that an employee can go to work. This is something that I get asked about all the time as far as, do I need a test before I go to work? There are some employers who are implementing strict criteria to ask for patients to get this, but in general, it's not something that we recommend because what that test looks for is whether or not there are any signs of virus in the swab that we collect, and that can include dead virus. And it looks like, and it seems like bodies keep shedding that dead virus for weeks and weeks after the infection is gone. Even when there's no live active virus that can be passed on to other people. So what's more reliable is that time from symptom onset, not having fevers, and just monitoring the patient to make sure that their symptoms overall have improved.
Dr. Egan, this is Dario. Just a quick question on testing. The availability of testing, we hear a lot of conflicting information on that. Can you speak briefly on Kaiser's position on testing and maybe anecdotally on the general testing environment today?
Yeah, so I think it's been pretty confusing to try to follow for everyone. And the reason why there's so much conflicting information out there is because it varies wildly from city to city, state to state, and healthcare provider to healthcare provider. At Kaiser, we have tried to keep standardized procedures throughout our whole region, so Virginia, DC, and Maryland. And we've tried to expand testing as we've been able to, as much as we've been able to. But not only has that been restricted by the number of tests that we've had, but every time we do a test, we need to have a nurse or other employee in full PPE with the gown and the face mask and the N95 mask. And we need to do it in a way that patients aren't getting exposed to one another when they are getting tested. So it's a very resource intensive process. Currently, Kaiser has recently expanded so that we are testing all symptomatic patients. So all patients who healthcare providers feel that they are presenting with symptoms that may be related to coronavirus. Originally, we were only testing high-risk patients who had risks of complications from coronavirus because that was limited. But that still varies from healthcare provider to healthcare provider and site to site. There's sites in Maryland, for instance, different state sites you can go to without a note from your doctor and without any symptoms and get tested. Some of them you need a note from your doctor, some of them you need to have symptoms to get tested at. And that's all based on both the availability of tests and the availability of staff and PPE to be able to provide those tests safely.
All right, well, I think you summed it up. It's a complicated and confusing issue still, I guess.
Continually changing. Every single week we're getting new updates on our end at Kaiser with how we're expanding testing. We are testing, the only asymptomatic patients that we're testing right now are patients who are about to get procedures. We're starting to open up our procedures when they're needed. And those patients are getting tested whether or not they have symptoms before they go into the procedure to make sure that that's safe for everyone. And I expect those to continually expand every single week as we get more supplies, learn more about this virus, and stock up on our PPE and everything else.
Thank you, I appreciate that.
All right. So this slide covers a lot of the information that we've been hearing, some from the beginning of this, on how individuals can help prevent the spread. And this all applies to the workplace as well as the home. So cleaning your hands often. This seems simple enough, but cannot be overstated. Anytime someone is exposed to the virus, if you touch a surface with the virus, that virus is not going to get absorbed through your skin. Your skin is a really good barrier and part of our immune system. It's only going to get into our body if we touch our face or with some of our mucous membranes after picking up that virus. So every time that we wash our hands, we can cut off transmission without that infection ever happening. Avoiding close contact with people who are positive and kind of limiting our contacts in general can really help prevent that spread. Staying at home if you're sick, this one is huge. I think we have a culture where people normally are used to going to the work even when they have a cold and kind of fighting through it and toughing it out. And we really need to change that paradigm in order to stop the spread of this and have people with any flu-like symptoms, respiratory symptoms, stay home until they're better. Not only will that prevent the patients who do have coronavirus from spreading it, but it helps everyone kind of simplify any worry about the spread and keeps our healthcare systems open. Covering your coughs and sneeze. So you've probably now heard about coughing and sneezing into your shoulder, if possible, into a tissue. We really don't want people sneezing into their hands or, of course, sneezing into the clean air, because those droplets that are sprayed when you cough or sneeze are the highest risk for spreading this virus and get it all over the surfaces, and it can linger in the air for a long time. And wearing a face mask is really important. You know, this is another thing that there's lots of conflicting information out there on. And part of the reason why there's lots of conflicting information out there on is because we don't have great studies in coronavirus specifically about how effective face masks are. And face masks vary wildly from type to type and how effective they are. But we do know that having a face mask on is going to prevent droplets, which are the highest risk for spreading this virus, from leaving an individual. So it protects those around that person, even if they're asymptomatic, but have the virus. And it likely, to some degree, helps prevent us from breathing in some of those particles. Not 100%, but at least to some extent. And then cleaning and disinfecting surfaces. Surfaces don't seem to be the main mode of transportation, so but those high-risk surfaces like doorknobs that everybody is touching, there is at least some potential for spread. We're just still learning how big that potential is.
And doctor, the mask issue in Virginia, the governor just passed a required mask other than for exercising, but is there a general consensus on outdoor mask use?
Another really contentious and
I'm hitting all the tough ones.
Yeah. You know, I don't think that there's a huge consensus on that, but really when it comes down to it, anytime that an individual is going to be within 6 feet of another individual, there's a potential for spread there. And if they're exercising, you know, breathing out more, that potential goes up a little bit. So if you're out and walking around and, you know, someone's going to be running by you, that mask is going to give you an extra protection. You can imagine, I live in downtown DC, and normally people are able to spread out a little bit on the sidewalks, but as soon as you reach that curb and you're waiting for the stoplight to change, people start to build up on the corner, and quickly can turn into a situation where you have multiple people within that 6 feet radius. So it's hard to say, you know, if you're taking a hike out in the woods and you're alone, it's probably not going to do any good for anyone. But we can quickly find ourselves in a situation where others are within 6 feet of us, and then that potential is there. A lot less than if we're inside and the air is stagnant, but still potentially there.
Thank you.
All right. And then this slide is kind of about the emotional impact that COVID is having on a lot of us. Amy's going to talk a little bit more about this later. But it's something for employers to keep in mind. There's a lot of anxiety out there. A lot of patients have gone through, people have gone through traumatic events, whether it's a family member passing away from COVID or just getting very sick from COVID, whether it's the isolation from having to stay at home, whether it's worrying about high-risk family members or their own high-risk situation. Remembering previous infections that they've had, worrying about their family and childcare needs, the children who are home from school, home from camp, who are going to need that extra care. This is taking an emotional toll on all of us. It's something that we need to be really cognizant of as we create policies moving forward. Next slide. All right. As physicians, our job to evaluate patients and treat them, in addition to testing whenever possible and indicated. As we approach the flu season in the fall, and we're worried about life-threatening complications from the flu, there's a lag in the number of our working age adults who receive their flu shots, and it's particularly important this year. So we're going to be encouraging everyone even more than normal when we come up on that flu season to be getting the flu shot. We don't want any chance and need to protect everyone against the influenza virus when we look at that going forward. We also, have mental health services that need to be taken advantage of by patients. So we were just talking about this toll that is being taken on all of us. For those who have low levels of anxiety, low levels of depression, those are all going to be heightened in a time like this. Everyone needs to be encouraged to reach out to those mental health services if they're in need of it. And employers can play a role in kind of watching out for employees who seem to be struggling and making sure that they know the resources for, if they have access to Kaiser's behavioral health program or an EAP program or whatever other resources they have. Next slide. All right. This slide just takes a look at the different masks that we have. You've probably all heard about these, but we have the N95 masks that are infamous at this point, the medical masks or surgical masks as they were talked about, and then the cloth masks that we're all encouraged to wear when outside. The respirator masks, those N95 masks, are what we use if we're in really high risk conditions in the medical settings. They're really only encouraged to be used for the medical setting in the medical settings right now. We are using them when we're in a situation where we expect a lot of droplets to be produced. So if we are intubating someone, if we're doing those nasal swabs and going, swabbing someone's nose or throat, situations like that, these N95 masks prevent particles from getting into the mask, in the wearer of the mask, and prevent particles from going outside of the mask. So they're very, very effective masks, but they're very hard for us to get our hands on right now and need to be used judiciously. The medical masks or surgical masks prevent droplets from being spread. Both prevent droplets from being spread from the wearer and to some extent prevent droplets from getting in when the wearer is breathing in. These are what we're using kind of in day-to-day in the medical facilities. They're disposable. They're a little easier to get our hands on. And cloth masks are really what we're encouraging everyone to use in the community, whether it's when they're going to the grocery store, the pharmacy, or going to work. This is what we're going to want people to be wearing when they're inside their workplace. It really helps to prevent the spread from those droplets and helps to some extent to protect the wearer from droplet inhalation, but definitely doesn't provide the same level of protection as the medical masks and respirators. One note on those N95 masks, I've seen a lot of people walking around with N95 masks that were bought at Home Depot or Lowe's or a construction site. You'll see a little valve on the side of the mask. A lot of those, the valves are one-way valves, which means that when they are made to protect construction workers from dust and debris. So they work well when the wearer is inhaling. They do a really good job at protecting from particles and droplets and everything when the person who is wearing them is inhaling. But when they exhale, that valve opens up and it just releases the air directly. So if you have any employees who are coming in and are wearing one of those N95 masks with the one-way valves on them, every time they exhale, there's no protection there as far as droplets and other aerosols coming out of it. So even when some people are thinking that they're going overboard and trying to be safe, there are flaws there if you don't completely understand the mask that you're wearing.
Yeah, that's interesting. That's interesting. The mask issue, because the mask is really about protecting others, and those people with that valve are probably, like you said, thinking they're doing a good job.
Very humid. They would roll it. It was very humid. It was frozen too much.
All right. This slide is just about COVID-19 on surfaces. This is another thing that's been in the news recently as far as the extent that surface transmission is something we need to worry about. We do know that when someone coughs or sneezes or even kind of is talking, a lot of droplets can come out of the mouth and they're going to land on surfaces. And there's going to be some extent of virus on that surface. When we think about that transmission, we need to think about not only whether or not there is a virus there, but the amount of viruses that is there. And that will degrade over time, depending on the surface. So you've probably heard that, you know, seen that study where viruses don't live very long on copper, live about 24 hours on cardboard, live much longer, maybe 3 days on plastic and some metals. But the amount of virus that's there is probably fairly low. To be on the safe side though, we want to be, again, cleaning those high touch areas like the doorknobs, light switches, handles, desks, toilets, to prevent that spread. The risk is much less than being face to face with another individual in close contact, but it's still possible. Next slide. All right, and then a little bit about the asymptomatic impact of COVID. So this is something that we are still learning about. But basically what we are thinking right now is that for about 48 hours before a person starts to show symptoms, they are probably able to transmit that virus, which is pretty scary because you might not be able to screen them out. And there are some people, possibly 25, 50, or even more percentage of people who aren't going to have symptoms at all, depending on the population that you're around. And those people can potentially spread the virus without knowing at all that they're even infected, without having a fever, without having a cough. The highest risk for transmitting that virus is someone who is coughing, is sneezing because they produce that large amount of droplets. But someone who has a large amount of virus in them and is not having symptoms can still potentially spread it. This is the reason why we do all of those universal precautions. This is the reason why we tell everybody wash their hands constantly. This is the reason why we tell everybody to wear a mask. That mask wearing is much more about these asymptomatic patients, whether they're going to develop symptoms or not, and preventing that spread. All right. This slide I'm not going to spend too much time on because it's constantly evolving, but just we've heard a lot about different treatment options that are coming out and being studied. I'm sure you've all heard about the remdesivir studies. This is a treatment that's useful in the hospital potentially. It's an IV medication, so it's not something that we can give someone a pill of to take at home. So it's really only for very sick patients. Potentially reduces the amount of time that those patients spend in the hospital, but has not yet been proven to reduce death rates. So if it has a real impact, and it looks like there is some impact there, it's not a dramatic one. This isn't a huge game changer. And then other studies, the cytokine inhibitors and the convalescent plasma, those are both things that would require kind of extensive medical treatment with IVs and other things, so they're not something that we can apply to the general public. The hydrochloroquine, now infamous treatment, even if it had worked, it didn't seem like it was going to have a dramatic benefit, but right now we're worried that it might be more harmful than good. So a lot of hospitals are pulling that from their treatment regimens. They're not using it. And we've heard some mention of this being used as preventative treatments for people who are exposed or just in general, but we have not seen any scientific evidence that that would work. And then vaccine studies. So vaccine studies, there's a huge amount of effort, time, and money going into vaccine studies. We have a bit of a head start because of what was done in the past with SARS and MERS. And, you know, we have some innovative approaches that are going to make this vaccine happen faster than any vaccine has happened before, hopefully. But that's still is going to take some time. Best case scenario, sometime in the fall, we would have good evidence of whether or not a certain vaccine worked, but it would take a long time to get that produced to the amount that would be able to get out to the general public. And we'll be unsure of how much that will protect it. If it's going to be like the flu vaccine, where it is somewhat protective and reduces the intensity of the illness, but does not completely knock it out, or whether it's like a more efficacious vaccine that really prevents anyone from getting the infection at all. Lots of news to come on this. Everyone will be watching those studies very closely.
And Doctor, a question on vaccines, ones that are maybe rushed. Is there concern about being kind of first in line, even if you could get it, to take a fast market vaccine?
I think that there is understandable concern about that. It's something that everybody's going to be keeping a close eye on because of the controversies around vaccines in the past. The scientific and medical community are very, very careful with vaccine production, and the standards that we use to produce vaccines and certify vaccines are very, very high because we're giving it to a uninfected, healthy population. But there's a lot of pressure on these pharmaceutical companies to come up with a vaccine as quickly as possible, and on governments to come up with a vaccine as quickly as possible. So I think that the process will be transparent enough that there will be enough information out there for there to be a healthy discussion about the safety of the vaccines, but definitely something to watch closely.
Okay, thank you.
All right. And then antibody studies, another kind of controversial subject that we're learning more and more about every day. We've seen some of the studies that have done sampling within populations, whether it's Los Angeles or Santa Clara or New York. And they're starting to show that there are many, many more people out there who were infected with coronavirus than tested positive for coronavirus through conventional testing when they were sick. So that we can be sure of, that there's many, many people out there that had coronavirus, likely were asymptomatic or had mild symptoms, and then recovered from the disease. What we don't know is how reliable these tests are. There's about 12 different types of antibody tests out there. Some of them are kind of rushed to the market and bypassed the normal approval process and are now kind of going through that process right now. The accuracy of these vary wildly from 50% to above 90%. So the tests that are 50%, that's a coin toss on whether or not the results that you're getting are accurate for some of these tests. And so we are still learning about that. Kaiser is trying to figure out how to roll out these tests. We've been very cautious in making sure that we have an accurate test when we do. And I think there'll be some big news to come as far as what's available for Kaiser patients moving forward within the next few weeks. But any testing that you see as far as antibodies, you have to be really skeptical of the accuracy of that. And then there's the whole question of what do we do with these results? The antibody tests are really helpful for public health measures so that we can get an idea of how much of the population has been infected, how wildly that has spread, and help us determine how we can prevent the spread in the future. None of these areas are coming close to what's called herd immunity that many of us have heard of, where there's enough antibody out in the population, enough people have been infected so that they're preventing the spread to others. We don't know yet if having antibodies will mean that you cannot get the infection again. It's likely that there is some level of protection moving forward, but whether that's complete protection, so you can't get infected at all in the future, or it just means that if you got exposed again, you would have a milder form of the illness, we're not sure about, and how long that protection lasts, whether it's no protection at all, protection that lasts about 3 months, 6 months, a year, or a lifetime, something that we're still figuring out and paying close attention to. So this is not something that should be used as far as allowing anybody to not wear a mask or not take the precautions that we already discussed, whether or not we know that they were truly infected.
Very interesting. And somebody asked a question about if they're isolating to prevent infection, do they have some sort of reduction in their general immunity by not being exposed to other things out in the that they normally would in their day in, day out lives?
I don't think that there's any validity to that. I have heard, I've seen some videos on YouTube suggesting that, but we are, we've spent our whole life cultivating our immune system, and it's not going to come crashing down in a few months. So I don't think that our immune systems are going to take a hit at all. And our immune systems are constantly being challenged, whether it's from dirt or touching surfaces around the house or pets, other exposures. And so I don't think that there's any concern there.
Okay. And just one last question I had for you was, have you seen patients with it? And is it as bad for a regular person, right? Somebody who's not going to end up in the hospital to get, COVID-19 as we.
Yeah, I have a lot of patients who have had COVID-19. We have fairly high positivity rates here in DC. I take care of, on my patient panel, about 2,000 patients. So, a number of them have tested positive. And for some, it's like a very bad flu. But I also have a number of patients who have ended up in the hospital and have spent a week, 2 weeks, or more in the hospital. So it's a very serious illness. And the patients who are getting a really bad flu are patients who, if they got the flu normally, would have a very mild flu. So it's definitely knocks them out of work for a few weeks and really sets them back. Because we're not doing asymptomatic testing right now, I'm not seeing those patients who, are having the asymptomatic infections. So my view is a little skewed now because I'm only seeing those patients who are having symptoms or only able to confirm them. But I've been surprised by the severity that this illness can have on even my younger and healthier patients.
Wow. Well, I appreciate that. I believe this is where Amy's jumping in. I don't want to, is that correct?
Yes. Yeah, I'm going to hand things over to
maybe
Amy.
Before we go forward, assuming as she's unmuting, Tracy, do we have any questions that maybe popped up for Dr. Egan as we transition to Amy's portion? We'll see. And I'm sure.
The only question I actually have, and that might be more of an Amy question, is if we know where hand-free thermometers could be obtained, purchased. I'm assuming like I don't know if we at Kaiser are utilizing hand-free thermometers, but that question has been asked.
I do not know the answer to that.
That might be something, Amy, or that we could always come back to.
Yeah.
Once we can check into it.
Okay, well, I'm gonna turn it over to Amy. I think she's working on her audio a second. Dr. Arnold, Amy's going to be joining us. Dr. Egan, I really appreciate you going over this information. I'm sure your time is limited with a panel of 2,000 patients and quite a bit of COVID-19 patients. Certainly, thank you so much for taking some time and sharing some of your context of what you're doing every day. We really appreciate it.
Oh, definitely. I'm happy to be here. I'm sorry for the audio issues earlier. I'm not sure what was happening with my microphone. But happy to be able to run through all this.
Yeah, well, as we're all learning, sometimes there's some technology issues that happen with any of these calls, but I think it was very, very helpful. So I think, Amy, are you there?
I am. Can you hear me?
We can, absolutely. So I'll turn it over to you.
happened?
Amy, we got you.
Hello, can you hear me?
Yeah, we can hear you. Amy? We can hear you. The question is, can you hear us? Somebody's typing.
Okay, so you can hear me again.
Yes, we can hear you.
I had to go through my computer versus my phone for some reason, so my
Okay.
apologies. So I guess this is a day of technology challenges, right?
I think it's a pretty light technology challenge so far, but absolutely. Overall, we're doing pretty darn good, I think. Amy, and I assume you can hear me, right?
I can, yes.
All right, great. Well, I'm going to turn it over to you, and we'll move through this section.
Perfect, perfect. So first of all, thank you, Dario. Thank you to Summit Insurance Services. We're so happy to be here. And of course, thank you, Dr. Egan, for really providing that excellent overview from a clinical perspective, which really sets up this next piece very well. So what you're looking at on your screen right now is essentially a framework that we created to help you to think through various health dimensions as you're thinking about supporting your populations returning to the work site or workforce. And so as you heard from Dr. Egan, obviously there's a pretty significant emphasis on physical health around workplace safety and testing. And there's also the mental and emotional health, which is really important. We'll talk about that in a moment. And then also the social health, which is really around the social and economic needs of your workforce. Next slide. Great. So the framework that I just showed you is also part of this larger, what we're calling Planning for the Next Normal at Work, interactive action guide. And as you can see on here, you're not supposed to be able to read everything here, but there's 7 chapters. We created this playbook because we were getting so many questions over the last month from customers and brokers and members about, can Kaiser Permanente share insights on returning to work, and what would we, recommend based on all of the information that's out there? Because as we've already heard on this call, right, there's a lot of information. It can be very confusing. And so that's really the reason that we created it. There's 98 pages. We're not going to be going through 98 pages, but know that you will be getting a copy of this playbook from Dario following this webinar. So you can go ahead, next slide. Excellent. So actually, let me set up the framework for this playbook. The idea is to help you to navigate, right there, because there is so much information. So what you'll find when you take a look at this on your own is that in the 7 chapters, they're all set up the same way. So you'll always find what's the problem we're trying to solve for. There will be some market information or statistics to help you to think through it. And then there will be resources, recommendations that are pulling from some of the most reliable resources that are out there, such as the CDC and OSHA, et cetera. And so for chapter 1 and 2, and we're not going to spend a lot of time going through these because Dr. Egan did such a great job on laying the foundation of what you would expect to find in chapters 1 and 2. So it's really, this first one is about how to think about your environment, creating that safe environment so that your employees can come back in. So everything that he was talking about with respect to employee sanitation, environmental sanitation, containment, mitigation strategies, suppression strategies, et cetera, that is all in here. So next slide. And chapter 2 really focuses on that whole notion of testing. And you obviously heard a lot from Dr. Egan, which hopefully will help you to think about, what's really necessary and what isn't. This also covers in this area, thinking about return to work or leave of absence, and, how to support your employees. So we saw that the government initiated some rules around sick leave, right, through the Families First Coronavirus Response Act or ACT, which requires employers who have less than 500 employees to provide paid sick leave. or expanded leave, family leave or medical leave for specified reasons related to COVID-19. It also means that if you don't fall under the regulation, then you should also be thinking about how to support employees if they call in sick. And, you know, questions you might ask yourself is, you know, do you have an emergency sick leave policy during this time? How flexible are these policies and so forth? So what you'll find in this area would be the symptom checker that you saw, or map that Dr. Egan went through before. That's actually in here. There's also screening guidance and workplace scenarios that you can take a look at. Next slide. So again, Dr. Egan was talking about the importance of mental health and emotional well-being during this time. It makes sense that everyone is really thinking about the physical safety of your employees first. That's really top of mind, the testing, health and safety protocols, leave policies, etc. However, you really can't ignore the mental and emotional impact for all the reasons that Dr. Egan was mentioning, you know, with social isolation, fear of uncertainty, financial stress, loss, grief, trauma, etc. There's a lot to be considered. And so what you'll find in this chapter are ideas on, or considerations on how to either build or reinforce a psychologically healthy work site. What does that mean? How to help your employees to feel safe from a physical and a mental standpoint, and also respected and empowered. So tapping into, if you have an employee assistance program, and if you don't, there are other resources that are available in these chapters to help support you. And then lastly, what I would mention on this one is that we have developed a mental health and emotional well-being webinar series, and all of those webinars are being recorded and they will be on demand. So what I'll make sure that we do is provide Dario with a link. All of these are public, and so you can help yourself. There's been some really great content that's out there that could help you to think through this, you know, how to create that psychologically healthy work site. Next slide.
Yeah, and Amy, I think you make a good point that we will be distributing this this playbook out to the group, and I really appreciate you saying that there's a library of recorded content, even if you're not a Kaiser member, that you can access. That's awesome. Thank you.
Absolutely. And I should note, so that library is primarily focused to support employers. However, we do have some other content if you're interested. We call it Mindful Mondays, but we have some recordings that are very specific for employees on coping with COVID and thinking about how to navigate for themselves. So I'm happy to share that with you as well. Okay, so, you know, when you think about it from a COVID-19 from a social drivers of health perspective, as unemployment and furloughs and overall job uncertainty increases, there's more and more households that have really experienced a loss of income and financial strain. And what this means is that obviously they'll have less money to meet their basic social needs, such as, you know, having enough food on the table for themselves, for their family. You know, can they pay their rent or their mortgage, utilities, transportation, and all of these other considerations. And so this chapter really examines how where employees live and the resources that they have to meet their daily needs can really impact their health. And then what can you as an employer do to help support existing employees, but also even employees that you may unfortunately had to terminate or furlough. It could be as simple as assisting somebody find, you know, a new job if you know of someone, or perhaps it's providing more flexible work schedules. There's many things that you can do, so this area will address that. Next slide. So as COVID-19 has very much disrupted, you know, health and finances and family responsibilities and many other aspects of employees' lives, HR really has this unique role and opportunity, right, to support the greatest assets of any organization, which is their employees and their people and their talent and you know, during this very uncertain time. So this chapter explores what HR may consider, which is, of course, all the things that HR always does in supporting employees, but really thinking through the policies and are there other types of policies you might want to integrate in to support your employee workforce. Next slide. So as we all know, there are many regulations out there, and it can be overwhelming, at the federal, state, and local level. And so what we've tried to do here is provide a collection of resources to really help you to navigate and inform your planning. And there is a state-by-state summary within this section, and that'll be continuously updated. And as a matter of fact, and I probably didn't mention it before, this is really a living, breathing document. So we just launched it a couple of weeks ago, and we will be updating it probably every couple of weeks. Our next update will be, I believe, June 5th. And because the science is changing, the information is changing, we really do need to continue to evolve. Next slide. So we thought that it would make sense, it would be helpful to highlight specific resources for industries that have unique requirements related to COVID-19 and perhaps just overall make them unique. So what you'll find in this section is basically a 1 to 2 pager on each one of these different industries. And we're hoping that it's very helpful to easily find information. And by the way, if you see that there's an industry that you would like to get more information on that isn't here, please let Dario know. We're definitely looking for input and feedback into what else we need to add into the playbook. And the last thing I would say about this area is just that whatever you see in terms of resources, it's really about reducing the risk and helping to keep your employees safe. So this wraps up the playbook overview. We wanted to just do kind of a high level brush on it. And again, you will be receiving the playbook from Dario. So I'm going to turn it back over to you, Dario.
Amy, thanks so much. I really appreciate that section about the industries. And I know the playbook itself is pretty extensive on the types of industries. And like you mentioned, we will be sending that out to the group. I did want to circle back on the mental well-being topic. It seems like when we transitioned to working from home, there was a lot of guidance and support and resources that we were trying to help our clients with and helping employees that are working from home. Now it seems like as we're getting ready to go back to work, there's a whole nother series of anxieties and stressors about going back to work. Have you heard a lot of that, or do you anticipate there will be, subsequent follow-up and resources available for that as well?
Yes, absolutely. I mean, we have already heard that, and I guess the good news part of that is that the resources that we do have will help to support that, because there's some commonality regardless of the situation that you're in that may be able to help in your conversations with your employees to help them and frankly help yourselves too to feel a little bit more calm and balanced. Mm-hmm. And I would say out of everything that we have out there, probably the biggest thing, and this won't surprise anyone, is really just keeping that open dialogue with your employees and giving them the space to be real about what's going on. And it is going to be hard, right? It already has been, and it will continue. Right. And we are planning to evolve the playbook and add more to that section. We're also going to be adding more webinars.
Excellent. Yeah. Well, thank you for that. And I appreciate you covering that section. I'm going to see, Tracy, have we gotten any questions in or open it up?
We do actually, and maybe Dr. Egan or even can speak to this. Questions about regulations requiring employers to notify employees who may have been exposed. So, and I've actually myself had a situation where within their workforce, somebody has been exposed to COVID-19. What is their responsibility to to notify other employees that they were around somebody who was exposed. Dr. Egan, is that something you could speak to?
I'm not familiar with the specific CDC regulations, if there are any around this. But I will say that, as we mentioned earlier in the presentation, this is an important reason why we need to keep a close eye on limiting the any congregating within the workplace, and keeping notes on who's in meetings together, who's sitting close to each other, so that we know those high-risk situations where someone is within 6 feet of someone for more than 10 minutes at a time, versus someone who's in the low-risk situation, kind of passing them in the hallway or in the same building as them, because that's going to play a big role in who you notify. And then it's going to be important to be able to make those notifications while keeping employees' confidentiality as much as possible, so that we don't scare any employees from notifying us when they're not feeling well.
Great. And then, Dr. Egan, maybe also just to circle back to the question about thermometers and taking temperatures, maybe you can recommend how we at Kaiser are instructing employers as they have employees come back. I know you mentioned have people take their temperature before they even report to work. What are we recommending as the best method for that to happen for the workforce as we're bringing them back?
So, the question is difficult because thermometers are very hard to get your hands on. I talk to patients all the time who are not feeling well and ask them if they can take their temperature at home, and they just don't have a thermometer at home. And in some cases, it's just impossible to get your hands on right now. But for those patients who do have, or employees who do have a thermometer at home, it's not a bad idea to ask everyone to just take their temperature just with the kind of standard route that they have at home, whether it's under the tongue or an ear thermometer or forehead. And really anybody who has a temperature above normal. And we have decided to set that threshold at 100 or above. Normally we would say anybody who has a temperature of 100.4 or above has a true fever, but to be extra cautious, we're using anything above 100.0 as our threshold. So asking your employees who do have a thermometer at home or are able to get their hands on one to take their temperature before they even leave in the morning is going to provide a level of screening that can prevent someone from coming to work and having to turn back around. And then if you're able to get your hands on a no-touch thermometer that you can use for screening when employees are coming in to work, that's going to help out those employees who can't get their hands on one and provide an additional level of screening and kind of figuring out where that threshold is that you're comfortable with. Again, that 100.0 is kind of a threshold that's a little bit below what we would normally call a true fever, but is an indication that someone's headed in that direction of having a true fever or has kind of a slightly elevated temperature, and just kind of knowing ahead of time what you're going to use as your cutoff for that. But keep in mind all of those asymptomatic patients who aren't going to get screened, who aren't going to have a temperature, aren't going to have any symptoms at all when you have those screenings at the door. So making sure that when those screenings are done, you're also making sure that employees are walking in as soon as they get into the workplace, or even the garages, that they're wearing their masks to prevent any transmission for asymptomatic patients.
Well, thank you, Dr. Egan. Tracy, any other questions as we wrap up the call?
No, I don't see anything else currently.
Well, again, I wanted to thank all the attendees to today's call. I will be following up this afternoon with a copy of the presentation and the Kaiser playbook. And most importantly, I wanted to thank our strategic partner, Kaiser Permanente, Dr. Egan, for taking time out of your day. We appreciate everything you're doing. Amy Arnold and Tracy Landricks, thank you so much. And again, I hope everybody has a wonderful weekend. With that, I'm going to conclude the meeting for today. Thank you.
Thank you.
Thank you.
Thank you.